A dental bridge is a restorative dental treatment method used to replace missing teeth. A dental bridge is a type of prosthesis used in cases of tooth loss in the mouth. It is also considered a fixed prosthesis because bridges are fixed in the mouth with cement-type adhesives. When we say bridge, we are talking about a structure consisting of at least two piers and one body. In other words, bridges consist of 3 or more teeth. We will tell you about the types of bridges that vary according to the way they are constructed. Dental supported bridge. In this type of bridge, the healthy teeth on both sides of the missing or extracted tooth are thinned slightly and used as legs to support the bridge. The prostheses fixed to these feet are extremely useful and aesthetically successful. Swing bridge. This bridge, also called a Maryland bridge, is made by bonding it to adjacent teeth. The artificial tooth replaced by the missing tooth is attached to the invisible back sides of the neighboring teeth. The back surface of adjacent natural teeth is roughened and adhesive is added. Both sides of the artificial tooth are fixed by applying these adhesive materials. The aim is to perform a bridge procedure by preventing the cutting of healthy natural teeth. Since it is not very good in terms of adhesion and fixation, it is not recommended to be applied to the back teeth that are involved in chewing. Even if it is applied, its usage time is quite short. Implant supported bridge. Implant supported bridges, a method used in multiple tooth losses, are increasing in prevalence today. It does not require teeth cutting because implants screwed into the jawbone are used as bridge pillars. Especially in cases where there are no adjacent teeth or in cases where the support teeth are weak, a bridge with implants is a very suitable solution. However, in order to place an implant, the jawbone structure must be suitable. This issue is something your dentist will evaluate. If implant planning is to be done, it would be appropriate to take a dental tomography and examine the bone amount and structure beforehand. Your dentist will evaluate which type of bridge will be suitable for you after your oral and dental examination. The position of your teeth in the mouth, your bone structure, or the number of teeth you lose will determine this situation. This video is for informational purposes only. We would like to emphasize the importance of consulting with your dentist to determine which treatment is most suitable for you. If you find our videos informative, please do not forget to like and subscribe. Wishing you healthy days.